Hello, I am Dr. Sridhar K, consultant neonatologist and pediatrician. Welcome to my channel. Thank you for watching. Thank you for subscribing. I would request you to keep your notifications on if you have not already done so. You have already watched many videos on newborn care, so I'll be splitting up into smaller topics and we will discuss them as we go on. So one of the common concerns that babies parents have is the stool pattern, and in this video it will be a short video on the stool pattern in babies. So the intestine starts forming right from the early stages of pregnancy. The contents of the intestine, the secretions from the liver, the bile, the content that the baby swallows from the amniotic fluid, all this starts forming the initial stool of the baby. It's dark green because the liver contents the secretions are bile. So most of the babies are expected to pass this dark green sticky stool in the first day within 24 hours, but up to 48 hours may be within the normal range. We should also remember that when the baby goes through a difficult labor process, we call it fetal distress, or if the baby is post-term, that is they have stayed in the womb a little beyond 40 weeks, they are more likely to pass this. So the anal sphincter relaxes and the meconium that is already down to the last part of the intestine comes out. So this is called meconium stained liquor, and this is a green material staining the fluid surrounding the baby. Sometimes if the baby has fetal distress, they may swallow this material and that leads to breathing difficulty. We call it meconium aspiration. So the aim of this video is not to discuss that. This is just to inform you about this condition. So we have passage of meconium which can be a bit delayed in the premature babies because the meconium has not reached the lowest part of the intestine. The less mature the baby, the longer it takes, and we may stimulate by using a suppository in the NICU to help that as well in such babies. And in terms of a term baby, if a stool is not passed beyond 24 hours, obviously all the hospitals have a system to check the newborn, and we check at the anal patency as well. So we may consider doing a probing of the anal patency after 24 hours if you are likely to go home early. If you are likely to stay on because you had a cesarean, we may wait another day if the baby is comfortably normal. If there is delayed passage beyond 48 hours, we start thinking of other factors. However, this applies only to babies who did not have the meconium stained liquor, because with meconium stained liquor, obviously the baby has passed stool even before the delivery, so we know that the tract is intact. After the passage of the meconium, the first 2 to 3 days, the pattern of stool is quite variable. It depends on how well the baby feeds, how well the gut is moving. So not passing stool for another 1 to 2 days is fine after the first passage. And once the baby starts feeding well, the breast milk is a predominant feed for the babies, and the stool pattern reflects that. So you get the mustardy stools. The transitional stools are where the meconium keeps changing. It becomes a lighter green, and then the mustardy yellow stools come up. I had mentioned in the video on lactose intolerance that lactose is the main milk sugar. The digestive ability of the baby keeps increasing. The lactase enzyme is upregulated after they are exposed to the milk. So as the milk volume increases, the lactase enzyme increases and the baby is able to digest the feed better. In the stage when the lactase enzyme is still upregulating, it has not reached the level, there may be increased frothy, watery stools. A little bit of mucus in the stool is not a problem. It's difficult to define it. It's part of the intestinal secretions. So if there is excessive mucus, that means there is rapid transit, and if there is blood in the stools, it's abnormal. After the baby's feeding is established, just a point here about the lactose intolerance. I mean, when the breastfeeding is ongoing, the baby gets a very gradual increase in the volume over the first few days. So there is enough time for the lactase enzyme to reach a level the baby can tolerate. When we give formula milk, however, in some babies there may be lactose intolerance in the beginning because the milk volume suddenly goes to a higher level than what the baby can cope. Of course, these babies manage as well. In majority of the babies, it's not a problem, but you may have to look into the dose. So the volume that we give by formula should be gradually increased. Don't go to very rapid increase in volume. So over the first week, you can start with 30 ml per feed for a term baby and go up gradually to 60, and after 2 weeks you consider going up to 90 if you are formula feeding. In breastfeeding, of course, the best way, the baby regulates the intake, and the milk output also needs stimulation and support. It's on the lower side rather than the higher side in the majority of the cases, so this problem doesn't happen. So the stool can be watery, it can be loose, it can be mustardy yellow, and in addition to the formed part of the stools, you have seedy particles which are also reflective of breastfeeding stools. The frothy stools and the frequent, even when the baby passes flatus, the water leaks. So this can cause nappy area irritation. So it's very important when the stool frequency is high that you use preventive nappy cream like zinc oxide containing creams like soda cream or other variants. So you have to have a barrier to avoid the skin damage, and using wipes during this phase when the baby passes a little bit of stool frequently, you may inadvertently put more pressure. So water is fine to clean these cases. Once the stool frequency is less, of course, you can manage as per the baby's skin needs. There are many breastfed babies who do not pass stools for a few days at a time. So this happens usually after the first 2 weeks once the lactose digestion is stabilized, and then they go for 4 to 5 days without passing stools. They are comfortable. Of course, colic may overlap, but this is not related to the non-passage of stools. And reassure the parents in this case, as long as the stool that's passed after the 5-day period is soft, you don't need any intervention. Please don't use any stool softeners or anything at this stage. If it is a formula fed baby or a partly breastfed and partly formula fed baby, the best response is to increase the volume of breastfeeding because that itself softens the stool. If it's mainly formula feeding and the stool is hard, you may consider switching the milk or you may consider giving a little bit of water or prune juice to the baby. So prunes are dry plums, and you may soak it in water. In the first 3 to 4 months, we give the extract of the prune. So after soaking, you give the watery content 15 to 20 ml twice a day, but you should make it in a sterile way so there is no risk of transferring infection. After 4 months for constipation, you could use prune juice where you soak the prune and you blend it, and that juice can be given directly. However, this is not recommended for breastfed babies because in breastfeeding, stool doesn't get hard. The idea of giving prunes is to soften the stool, so you don't need that in breastfeeding babies who have infrequent stooling. It's absolutely fine to pass stool every 5 to 6 days, and sometimes I've seen babies going for 8 to 10 days even without any problem. However, in practical terms, if not passed by 6 days, parents get quite anxious, so we may consider stimulating locally or using a glycerin suppository, which is again harmless, but you don't need to do that before that period of time. Constipation in a baby is not common in a breastfeeding baby or a predominantly breastfeeding baby, so that's another reason to predominantly breastfeed. And formula feeding has a tendency to cause constipation. Make sure you're mixing the milk in the right proportion. There are milks which are more suited for constipation, so which reduce the risk of constipation. If your baby is prone for that, you may use such formula as well. I'm not naming anything here. If you have a family tendency to slow gut movement, you have to watch for that as well. So in terms of stool pattern, this is an overview. I hope this is useful, and please subscribe, do share the information with your friends and relatives as well. If you have any questions, feel free to mention it in the comments box below. Thank you.